Morning, welcome to Thurston County Board of County Commissioners, Commissioners Check-in for Thursday, January 14, 2020. It is 10 a.m. My name is Ty Menser. I'm Chair of the Board of County Commissioners. We have Vice Chair Commissioner Gary Edwards and Commissioner Carolina Mejia, as well as our County Manager Mira Chavez, for this somewhat informal review of a few specified items and then a few open items for commissioners to check in on. We do have an agenda today that includes couple particular items. First on this list is TCOM 911 letter. Public may follow, before we get into that, public may follow along on our YouTube channel. This is live streamed. And there is a call-in option at 360-252-9020, pin 1234. So Ramiro, why don't you lead us through item number one?
Yeah, thank you, Commissioners. On January 7th, you received a letter from the chair of the Thurston 911 Communications Board of Directors. That's Mr. Eleni Grenstein. He is a council member for the city of Lacey. I have attached the letter in your documents this morning. And the gist of this letter is requesting the Board of County Commissioners to acknowledge the staff on the 911 be considered as a first responders. And first responders, it will relate to vaccines. And from this letter assumes that if the board agrees on recognizing 911 staff as first responders, they will be included on the phase 1A1 of the vaccine distribution. So that's the gist of that letter. I don't know if you had the opportunity to read that when you received. This has been a very interesting subject to discuss. You discussed the vaccine phasing on your Board of Health meeting this past Tuesday. And is very complicated. In terms of the phases is given by the State Department of Health. And with all due respect, the Board of County Commissioners has little latitude to determine a specific group as to how they can move and qualify to the different phases. And my response to this is not by no means a disrespect to the value the 911 personnel brings to the overall operations. But also, I do believe that there is a very difficult path to go in for the Board of County Commissioners to acknowledge specific groups and make your determination as to what groups should be part of the different vaccines, which may be deviating from what the state has provided. As an example, you had a conversation this past Tuesday that you would love to have the teachers being included on phase 1A. But unfortunately, that is not part of the latitude that any county has or any local jurisdiction has. So my proposal to you is in response to this letter, and I have checked with public health, obviously, is to thank them for the letter recognizing their value they bring to the overall operations, but unfortunately the board doesn't have that latitude to designate a specific group as to how they can move between the phases of vaccination. There is an opportunity, I believe, that the staff from 911 can be included on phase 1B, tier 2 or tier 3. And there is a move afoot, I believe, by the state. They're going to expedite those phases based on the additional vaccines the federal government is going to be issuing. And also, you may recall over this week, the CDC guidelines expanded the groups as to how the vaccination can be expedited. So there may be an opportunity when the new guidance by the state is provided for those individuals involved in the 911 dispatch room can be accessing the vaccine sooner than the rest of us. So that is the framing of this issue.
Questions, comments from my board members? Carolina.
I have a comment, Chair. I just, So I think County Manager Travis mentioned what phase they were going to become 911 operators fall under. What phase is that specifically? Do you know, Ramiro?
Phase 1B, Tier 2, and that will be the critical workers 50 years and older. But also there is going to be a little bit of flexibility, I believe, on the new CDC guidelines that the state is going to be issuing, I believe, this week. And also for those critical workers under the age of 50, they will be included on Tier 2 based on the guidelines that will have been provided.
I also have a comment, sir.
Go ahead.
Tier 4.
I guess taking into consideration what the county manager has said, I recognize that that might be outside of our bailiwick. But if you would think about the effect of having an outbreak in the communication center where all the ambulances and fire and police are dispatched from, they work in relatively close quarters. It would shut down a major part of our ability to provide services to our constituents, more so probably than anything else. And because of that, I think we should respond in some fashion that shows that we recognize that, and possibly a letter to the governor from our Board of Health, which is the same body, asking for a reconsideration of the designation. So that's the importance of this is more than you might seem. So that's kind of where I'm at with it.
I have a question about what we're actually being asked. The letter says they're asking the board to designate their status, and I don't really know what that means. Did the state hand us a form and say, Thurston County, designate who you think are public safety first responders, and we'd add their name to a list? I mean, what does it mean to designate? Is there any meaning to us doing this?
Yeah, there is really not an avenue, and you keyed right on point. There is not really an avenue. The board can take an action and determine a specific group meets that criteria. And I believe what they're suggesting in this letter is under phase 1A is a high risk first responder. So they make the argument they be considered on this group, and the board to recognize that recognition. But there is not really an avenue or an instrument that the board can take to recognize those groups and move them from phase to phase.
I guess, could I follow up on that, sir?
Go ahead.
If it was up to me and I could get a second vote on it, I'd say pull whatever vaccine you need to pull and get them vaccinated right now. And I don't care what the governor says about it, because sometimes your bureaucracy doesn't recognize everything that needs to be done. I'm not saying they didn't do this in good faith, but I feel the same way about school teachers. If we're going to open up schools, the governor's, I don't know what the deal is with the governor, or how come he would put school teachers and prisoners in the same category and claim that he's wanting to open up the schools, and the teachers union has said they're not going to open up until they get vaccinated. So I don't know what this is all about, but at some point I think it's up to us to put our foot down. What are they going to do, take our birthday away for giving our emergency dispatchers the inoculations that they need to keep the rest of the community safe? I just think somebody's got to step out of line here once in a while. I'm not very good at marching over the cliff just because somebody says, get to the bottom of the cliff, and you got 2 seconds to get there.
Maybe I can provide additional information to Commissioner Edwards' response. As you may recall, the county is not issuing vaccines, depending on outfits and businesses have qualified in the Department of Health to State Department of Health to issue the vaccinations, such as clinics, the hospitals. So with all due respect, by you acknowledging this, and they go to the clinic, they're not gonna get vaccinated because they don't meet that criteria. So I understand your frustration. I'm just trying to work through the mechanics of the options that you have. Because if you were to have those options, believe me, there will be so many groups that will come to you for you to acknowledge who is a first responder. And you keep right on the point of teachers. I believe if there was an option by the board to change the criteria from the State Department of Health, I believe you would consider bringing the teachers to a early phase. And I don't want to, and again, I apologize. I don't want to be disrespectful for the board, but I'm struggling because I don't think there is mechanics in which you can take those actions. Because again, it's clinics, hospitals, and everybody else who is qualified to issue the vaccinations, and they are the ones who are providing the checkbox in a way on the different phases the state has provided.
I have a question or a comment. I don't know exactly what, but you know, I definitely agree. You know, just with what we heard Tuesday, that our teachers should have been in that first phase. And in my opinion, you know, TCOM 911, it does fall under first responders. They are right there answering the calls of our community whenever they reach out. And I understand that we're very limited on what we can do. But maybe I agree with Commissioner Edwards in writing a letter to the governor, just maybe expressing our frustrations with the phases, and you know, not that I proclaim that I know better than the people at the Department of Health, but just maybe a letter explaining the frustrations that their phases, you know, are, and how they're affecting our community.
I guess one size doesn't fit all, so.
I don't disagree with that. That's absolutely
Yeah.
I just think that somebody has to stand up and point out stupidity when it exists. That's all. I mean, we can be polite about it and put that in a letter to the governor asking that he reconsider. I mean, if we were in a community and each fire department had their own dispatch, each law enforcement agency had its own dispatch, all the ambulance had their own dispatch, it's not so crucial. In our situation, we're a consolidated entity that we have nowhere else to go if we have an outbreak. And I just think it's paramount that we get it done right. In those other situations that I mentioned, you have mutual aid issues that, okay, if your dispatch center is down, we'll take care of that for you, or, you know, something. Well, I'm not very good at being a lemming. That's all I'm gonna say. I would like to write a letter.
I mean, but if we're gonna write a letter, then, I mean, sorry, Chair.
No, go
I
for
spoke
it.
out of
This
turn.
is an informal meeting. Welcome.
You know, if we're gonna also, I mean, we also have Public Works, that, you know, we have all these situations going on, especially with, we're just in a very complicated situation. I mean, and I think the frustrating part for the community is that we have so many vaccines that haven't been administered yet, and people are seeing this, and they're seeing the data, and they're saying, well, and so again, there's, I don't have a solution. I'm just also expressing my frustration with the whole process, and because, you know, the people that are fixing, you know, the power right now, they're not vaccinated either, but yet they're also in the front lines in a sort of way, trying to make sure that we all have power and electricity in our homes. And I don't know, maybe a letter is the way to go to the governor, just, you know, respectfully requesting that changes be made, or maybe that each region determine their priority list. I'm not sure.
I don't think we have a lot of control, and to the extent that we do, I want to focus it on our teachers and our kids. And to me, it's an element of control. So, for example, I was a little disconcerted in December when the guidance about schools came out, but yet we weren't allowed to have a social gathering with more outside your household. So, because to me there was a disconnect there about our ability to control a situation. So if I go to visit my mom, I know what my mom's done. She's an adult. I have control over the situation. I can make sure we're distanced, and I can make that a very safe environment. When I send my kindergartner into a kindergarten class with 15 other households, I don't know if they mask in those other 14 households. I don't know how they're going to be able to interact and who's going to be able to maintain interactions with kindergartners. We have no control, and that's going to keep people unsafe and enhance and exacerbate community spread. So analogizing that thought process to this, I've seen the 911 dispatch center. I don't know how they're set up now, but I'm sure they can have plastic, barriers. They sit in kind of a quasi cubicle situation. They're adults. They can distance. They can manage a situation. We're about to reopen all of our elementary and middle schools potentially, with all of those concerns that I've identified, without our teachers and school staff even being prioritized for vaccines. So, that's just an uncontrollable situation. It makes families extremely apprehensive about sending their kids back to school. As Commissioner Edwards said, the kids are 30% of our population, 100% of our future. We don't know what the long-term effects of COVID-19 are. And so I would imagine, I don't know what the thought process is of the Department of Health. I'm not in those meetings, but I would imagine they're looking at situations that, to maintain control over the environment. And that's why they've been so cautious with protocols in schools and seeing how it's working. And now we're ready to go, it sounds like. But the board directed Shelley and Dr. Abdulmalik, who sit for the county in those meetings, we directed them Tuesday to advocate for moving the teachers, all teachers, whether they're under 50 or over 50, up the chain. That's a policy change that I support. I mean, to the extent that we have any influence into this process, that's where I want to focus it on. Sending another letter, competing, advocating for another group that really can control their environment much more carefully than schools, I think dilutes potentially the impact of what we're trying to advocate for our schools and our kids. That's just my 2 cents about it. Plus, I don't think they're going to listen to that anyway. I mean, again, if it was a matter of including this group in a designation that the county is asked to provide, that's a different situation, and I'd be willing to think about that. But in terms of trying to advocate for the state to change priority when we're already doing that, if you guys want to write a letter, I want to write a letter about teachers in schools.
We could add it. You could put it all together.
Well, I mean, like say, if that's the focus of the letter and we add a paragraph that says, we also have a local concern about whether or not, 911 folks should be a designated first responder, as an adjunct. Like say, I don't have a problem with it. I'm not opposing this concept, but in terms of where we can have the most influence and what the priorities are.
Good. Could I suggest next steps?
Sure.
I know that you can discuss this for an hour.
Yeah.
I will draft a letter for your consideration in response to the TCOM 911, obviously acknowledging recognizing their value, but unfortunately it's very limited what the Board of County Commissioners can do in changing from phase to phase. And for the letter to the governor, my recommendation will be to wait until the new phases they're going to be unveiling here in the next couple of days, I believe. And then we'll have an indication from your perspective whether there is an opportunity for you to advocate additional changes. Because what we have received is going to change. And as far as I know, Shell and Dr. Abdulmalik, when they have met with the Department of Health yesterday, they advocated and they delivered that direction the board suggested on Tuesday. So whether that recommendation is going to be included in the new phases, But at this point, knowing that this phase approach is going to change, I don't think it's going to be fruitful for me to write a letter based on this criteria because it's going to change.
Could I make one suggestion to that?
Yep.
Why couldn't we do at least a notification to our, to Shelley at, you know, the health department, so that at least she knows we want to include the communication folks with the teachers. I agree with Commissioner Menser on that. I think teachers are like super important. We had to trust our future to our teachers. They're getting a raw deal as far as I can see.
Certainly, I can reach out to Shelley if that is the.
Okay, you do that?
Yeah, absolutely.
And maybe in your letter, back to Keith, we could, or I guess to Lenny, we could at least say we're restricted on what we're allowed to designate, but we have passed that on to the appropriate bureaucrats. I don't know how you want to put that.
I wouldn't use bureaucrats,
Okay.
but I get the gist of the comment.
I didn't think you were going to go along with that, but I just thought I'd throw it out anyway.
Okay, so I'll draft the letter in response to Mr. Bernstein, representing TCOM 911, reach out to Shelley to make sure that we include as part of the recommendations of TCOM 911 personnel to be included in early phases, or at least to be recognized. And then I will wait until the new phases, the Department of Health is going to be released, and then we'll engage in a different conversation whether that letter to the governor is still part of the plan.
Okay, let's go to item 2. We're good on that. This is NACO event, and looks like there's a quick email here that Robin brought up.
Yeah. Including your packet, commissioners, there is an event planned for this coming Tuesday, January 19, 2020, and that is just about 2:30 in the afternoon. And the intent of NACO event is to recognize those individuals who have died as a result of COVID-19. Is more of a memorial tribute. And I'd like to propose a couple of steps for your consideration. We're drafting a message the board may probably deliver, and we will have a 2:30 live stream of that message so they can be heard. And also, I'd like to recommend lowering the flag on January 19th in recognition for those citizens in Thurston County who have perished due to the COVID-19. Those are the 2 recommendations related to this event.
I have a question.
Yep.
I understand lowering the flag, but I didn't get exactly what was going to happen besides that.
Yeah, we're drafting a message for the board to read on Tuesday at 2:30 in the afternoon on a live stream meeting.
So we'd like stop at 2:30 in the board meeting, and
So we don't have a board meeting?
we don't have a board meeting, that's right?
So, and that's what I think just presents the opportunity, and we just include that in your agenda. This will be probably 5-10 minutes. We're working on a message for the chair to issue. I'll give you that draft. But also we'll give the opportunity for the other 2 commissioners to express your personal perspective, acknowledging those individuals who have died due to COVID-19 in Thurston County.
And this is going to be addressed by 38 other counties as well? I mean, what, are we going to just take turns, or?
No. Each county across the nation is going to do different things. For instance, they're going to have a candle vigil. Some Some they're going to turn all the lights out. So there's many counties are doing many different things
Okay.
across the nation.
I see. No,
Yeah.
sounds good to me.
And if you agree, then we'll submit this information to NACO just to make sure what Thurston County is going to do. I think Robin likes to add additional info.
I'm still a little confused. So we're not having a meeting, like we'll go on YouTube, like as it, just for this purpose?
Yeah.
Kind of a special meeting type
Yeah,
thing?
yeah, we'll add it to the
I don't mean
agenda.
that I don't mean that as too far, but.
It's a regular meeting.
Make sure you
Yeah,
get
regular
the
meeting,
notice right.
sorry.
Get the notice right.
Should we, how many, I'm sorry, I do not remember the exact number of how many people have passed away here in Thurston County.
59.
59? I was thinking 58, 59, okay. Maybe a second of silence for each person who died, so 59 seconds, and ask the rest of the departments to participate.
Yeah, excellent. I mean, all that is good ideas that you may want to exercise and do that on via while we have the live stream. You know, yeah, that's the reason as to why I like to bring staff's proposing those two actions. I mean, you as board members can, yeah,
Sounds good.
maybe during that meeting, Commissioner Mejia, you can ask that and have a moment of silence of 59 seconds. Good idea.
Okay, sounds
Okay.
like we're good on that.
Thank you. So we need to add to the agenda. Thank you.
Okay, in this particular meeting, we typically kind of merge through number 3 and number 4. Whether you want to report on a particular external board or just have an unrelated commissioner item that kind of straggles around. So I'll just, maybe I'll start with Commissioner Mejia for this, and we'll just kind of go around with issues or reports as you feel you'd like to.
I don't have anything to report on a specific board. I'm setting up orientations for 2 of them, so I'm still in the process of getting caught up. But I wanted to bring an item to the rest of the board's attention of the security in Building 1. I've spoken with the county manager, and he's let me know the past history of trying to get security in Building 1, but I think it is important that we have that, and maybe something we can start discussing again, and maybe it's something we can discuss at the planning session on the 29th, but definitely something I want to really start discussing about the security of all of our staff who work here.
Okay,
Good.
And so that's it for me.
Commissioner Edwards. Either.
I guess as far as commissions and whatnot, I've already reported on those, but I would like to comment. I attended a housing plan last night.
TRPC?
Pardon?
TRPC?
Yes.
Yeah, oh, good.
And I didn't go away from that with any plan or information. I didn't notice that we had solutions, but I'm wondering, I would have liked to seen somebody there. They had a realtor there that gave a pretty good breakdown of kind of what's going on and where we're at. But nobody from the building community was there, and it was all about how can we get more in tune with creating affordable housing. And so I kind of went away from that wondering what was the end result. Now, maybe I just missed something. I didn't get on for about 5 minutes after it started. So I don't know, maybe you folks have, if either one of my seatmates were there, what they thought.
I was there and I didn't get a lot out of it. I was going to reserve judgment until I actually look at the written plan, because they went through the 6 strategy areas, but they were really like high level. And then they didn't really talk about like one of the 6, for example, was, you know, probably something you were interested in. It said, make it easier to build or whatever, make it easier to, you know, that was the phrase, make it easier. Like, well, what does that mean? You know, like, okay,
Yeah,
I
right.
make it easier. Like how? I mean, so they didn't go into any detail, and I don't know if that's in the written plan. They just didn't feel like they had the time to walk through the details. So I'm going to look at the written plan, but if it's not any more specific than what we heard, I agree with you. It wasn't particularly, I mean, I've gone to a lot of these now over the last 3 years, so it wasn't really anything I hadn't heard before at a high level. There wasn't a lot of detailed strategy that was presented by Katrina over at TRPC, but maybe there's more in the plan itself.
Yeah, I second that too. I thought the information that was given was pretty general, and like Ty said, things we've heard before. So I'm hoping if there is a written plan that we could get our hands on it and review it, and maybe they go into detail and break it down much more.
Okay.
My issue that I wanted to just touch base, kind of related to Carolina's about the security, is more about specifically January 20th security. And, you know, there's a couple of things that I'm worried about. You know, there was a couple nights ago reports of groups wanting to storm government buildings on January 20th, and we are government buildings. I don't know that we're necessarily on the radar, you know, or the target of any group. I haven't heard that. But I spoke with Judge Price this morning during my check-in with him. It's also been suggested that the courts could become if there's a bunch of arrests at the Capitol, there could end up being a pivot to our buildings as folks that are arrested get arraigned or docketed on the court. So I know that I touched base with county manager, and I know there's discussions with the sheriff's office, and I just wanted to make sure that, you know, if there's you know, I don't necessarily expect something like this, but I want there to be like sort of established points of contact. So like, for example, if court security sees anything, they know exactly who to call. They have a liaison. And Judge Price emphasized, when I brought this up with him, he really jumped on this and said, yes, we really need that, because what I didn't know about till this morning is that when that Farm Boy case came, there were threats made to one of our judges. And there was contact, there's conversations, and the sheriff was very responsive, but they didn't know exactly who to, you know, they didn't know who their go-to person was. So I guess I'm kind of throwing this out there for discussion, and if the county manager can make sure that, you know, we have those established lines of contact.
Yeah, if I may.
Yeah.
As soon as this national threat came out, I did reach out to the sheriff's office. I had a conversation with the undersheriff, and I don't want to get obviously too much into the details of the conversation, but the bottom line is they're tracking. They're going through the process, making sure that if something becomes evident, they may see any protests here in the courthouse, they will be ready to respond. The level of response, I don't know. I'm not an expert, but the sheriff's office is tracking. The sheriff's office is monitoring, and I have the sense the sheriff's office obviously is ready to respond, as well as with the rest of the local law enforcement.
Okay, and and again, I don't know we're not going to get into that in this meeting, and it wouldn't be appropriate to do so, but if the court security folks are looped into this loop, and because the courts, by the nature of what they do, could end up being a focus. They've been mentioned, courthouses have been mentioned, and
previous protests, the line of communications has been enhanced. So I know there is a line of communication between the court security and the sheriff's office.
Great. I don't mind to see people protesting. That's fine. But if I see people walking around with zip ties and erecting a noose out in the parking lot, I'm going to be a little concerned. Okay, Commissioner Mejia, anything else? We don't have to spend our full
The gift of time.
90 minutes if we don't have anything else that we need to address.
I don't have anything else to address. I
Okay.
think, sorry, I do actually.
Yeah.
Just to add on what you were saying regarding the case that was at Superior Court, I believe that case is going to be on also next week. So maybe shooting an email to staff just to, expect something.
Appreciate it. So I will send an email when that, as I have been, just to make sure we are aware. Okay.
And that's all, Chair, for me. Sorry.
I guess what I would say is if we do go into that type of a discussion as to how we're going to protect personnel and the courts and stuff, there must be a provision. Usually I am not in favor of meetings in secret, but on security issues, I think there's a provision that we can talk about that stuff offline, I guess, if you will, can't we? Where we don't have to divulge to potential adversaries what the game plan is. So
Yeah, I think you're right. That's why I was trying to be careful in what I was saying.
we can certainly talk about that, and I don't know if you want to talk. I don't know how that works. I guess the chair could call a special meeting for security.
No special meeting is an executive session that gives you the latitude.
Okay, I know we're a little touchy on that topic right now, and looking forward we'll get that fixed.
So yes, there is an element within the executive session law that allows you to meet on those terms. So if the need arises, I will certainly bring the board in with the sheriff's office if need be to have those conversations in an executive session.
Yeah, we've got this is inauguration is Wednesday, and we have a Tuesday morning. So if there's a need, then please don't hesitate.
And I will be prepared with the appropriate RCW if need be, and you can call an executive session during your regular meetings.
Okay.
I guess from my perspective, to address Commissioner Mejia's concern with the court, she's obviously very familiar with their operation and everything. So I would be willing to meet whenever between now and then if it came to some kind of a game plan that was needed to, work with the sheriff or whomever.
Yeah.
I want to make sure that that issue is covered properly. So. I guess we do have time, it sounds like, and we'll probably have a bit more intelligence by maybe early next week,
Yes. Yeah.
Monday,
in fact,
Tuesday, something like that.
I will check again later today.
Perfect.
Okay.
Thank you.
Okay, so I really don't have anything else to add to that issue either. I will say the one issue maybe I would bring up, one more thing. I got that award, at a Christmas party one time, one more thing. We had talked about expanded hours at some point, but that's going to take an ordinance change or something. Is that right?
Yeah, I'm working with Elizabeth, and in fact, I had conversation with her yesterday.
Okay.
So we'll bring a proposal to the board here shortly.
Might that be something for our work? We've got something going on the end of the month for
Planning session.
planning session. Huh?
It could be or before then.
Okay.
We're working on a proposal.
Okay. And Chair, I'm good too, sir.
Okay, well then let's adjourn, and I'm not sure when the next time we'll be back in session. Do we have anything jointly tomorrow?
I don't think we have
Let me
joint.
double check the schedule. Hold on.
individuals,
I
I
got,
think.
junk- I got junk on my schedule, but. I don't
Right.
know if it's-
I don't think we have any joint meetings on Friday.
Let me jump on the master calendar.
Yeah, no, it looks like we're back Tuesday morning.
Yeah. The only item I think is the study meeting. You have been invited tomorrow. Yeah.
Yep.
Okay, we're adjourned. Stay safe, everybody. See you on Tuesday.
Thank you.